Hi, my name is Ariel Feiga, and today I'm going to be discussing the big and complex topic of trust and how it relates to health in our daily lives. So, what is trust? It can be generally defined as the assured reliance on character, ability, strength, or truth of someone or something. So, that can be seen on many different levels, from our friend groups to family members we confide in, lovers, and even products and brands that we use on a daily basis, such as maybe going to Starbucks every day because you can trust that you're going to get a drink that tastes exactly how you want it versus going to a new store and maybe having to try out different flavors until you find one that you like, which has that brand success and that brand trust. There are a multitude of benefits that come with trust on many different levels of health, including social, mental, physical, as well as spiritual. Within these affected levels of health, people who trust tend to have great social bonding, which is that feeling that others care and can be relied on, establishing that social support and friendship that we've discussed over and over in this class, and its importance to individual peace and that reduction of stress and that coming to centeredness. As well, it can be really important in persuading people and changing minds and sharing ideas and maybe getting what you want out of a relationship or out of a situation. Having that trust makes people more open to your thoughts and has a greater likelihood that you'll change their minds. As well as it produces that societal strength that people feel safe and cared about and comfortable even in the presence of strangers, which creates a stable and strong society. I had the opportunity to see one of those when I went to Japan for a month over the summer last year. We stayed in a village called Yamanashi, which is kind of small at the base of Mount Fuji, and my boyfriend and I were noticing that all of these elderly women were walking to the market, and it's about a 15-minute walk from like where the homes were to where the marketplace was, and there weren't a lot of street lights or anything, and so we asked our guide who lived in the area, hey, aren't you worried about these women, crime happening to them? There's not a lot of street lights, they could be hit by a car or something like that. And he really didn't understand our question. He was confused about, our definition of crime. And he was like, no, we don't have that. We trust people out here. We have a really feeling of connectedness, and we just trust everyone, and it's not like that, which is really interesting to see from a Westerner's perspective. As well, you get that mental benefits of that decrease in feeling of isolation and depression and anxiety that you see with many other types of social connectedness. And here at the bottom corner, I have this little map that has the reported levels of interpersonal trust amongst countries, and then the dark blue being the most connected, and then the dark red being the least. And you can see the United States is somewhere in the middle here with, not just about average. So we have a little trust for each other. That's positive. So how do we build trust? There are many different factors that cause us to trust someone, and studies indicate it goes way beyond individual personality factors or propensity to trust. So it's not one particular demographic of people that's going to trust more than another. There are certain factors that we look for when we decide to trust someone. And so I'm going to go ahead and start this TED Talk. It's kind of a long one. I do encourage people who are interested to go back and watch the whole thing because it is a good one. But I'm going to bring us kind of towards the end. Essentially what Mr. Davis is discussing is, what builds trust. He looks at many different studies and compares world leaders from modern history and boils it down to his own experience with a paragliding experience, and very, very simplistic form to look at. So I'm going to go ahead and start this for you. Great. So what he dives into is that perception, that individual perception, again, that we keep seeing over and over, of ability, which is, the capacity of that person to do what they say they're going to do, which can be seen in like a group project when you're, looking at a person. Do you believe that they can do the assignment that they've been given? Benevolence, which is feeling that they care about you and that they have a vested interest in your success and what you're doing, and that's very important to those intimate relationships as well as friendships. And then again, integrity, that they have strong values, that they believe in their values and they'll stand up for what they believe in with honor throughout situations. And then on the opposite side of that, not having trust can, of course, reduce the risk of being deceived or hurt, as, you never let anyone close enough to do that to you. However, with that comes feelings of anxiety, depression, insecurity, and isolation, as you don't really have any of those close bonds or ability to fall back on anyone if you need to. In one study that I looked at, comparing stress, anxiety, and depression levels in romantic couples varying from dating for a few months to married for years, and then compared that to their reported trust levels of their partners, found that trusting one's partner has a positive correlation to physical wellness, such as blood pressure, heart rate, and it can decrease in events of anxiety and depression. And previous levels of trust predict later levels of mental and physical health, which may indicate causality. So that means that if you trust your partner early on in the relationship, it's going to have a greater impact on you throughout your life if you are like a long-term couple. Sorry if you hear wailing in the background, that is my dog. Alright, trust in healthcare. Trust is integral to many interactions between patients and providers. It can cause a notable influence on health outcomes and appears to be really impactful on patient satisfaction, adherence to treatment options, encourages patients to access healthcare when they need it, and of course to make appropriate disclosures so that the provider can diagnose quickly and start treatment effectively.